Good morning, everyone. My name is Ed Curtis. I'm President and CEO of Memorial Health System here in Springfield and throughout the 10 counties in central Illinois, and we're excited to have you here today. We're excited to have our leaders of the General Assembly, the governor, the lieutenant governor, and I'm going to let the governor introduce our distinguished party behind us because we have a lot of speakers here this morning. But a couple things that I want to say to you this morning in opening and why Memorial Health System's glad to be hosting this event today. The last 15 months, we've all endured this terrible pandemic. And I'll tell you, I've had a front row seat. And I've watched the leadership of this state with this governor and his team, public health, all the staff and the state agencies have guided us through this pandemic, first with getting us the equipment and supplies that we needed, giving us all the education, and then when vaccination came to make it readily available throughout the state of Illinois. Today, over 9 million people are vaccinated. Phenomenal. 46% of those over the age of 18 have got vaccine in them. We're so close. We just need to keep pushing that message out there. But one of the things this pandemic showed all of us, it shared a very bright light on the inequities in health in our communities here, in our state, in our nation. One more time. And what we're here today to sign the fourth pillar of the Black Caucus legislative initiative around health care. And I want you to know this is a transformative piece of legislation that's going to benefit all, because we're not here to provide patient-centered care to those that are privileged. We want it to be for everybody, every time. And I am so proud to be part of this program today and watch this piece of legislation being signed. And I'm very proud to live in the state of Illinois that I love, was born in. I have 4 generations living here in this community, and I'll never leave Illinois. And that's why I'm so proud of this governor, his administration, and the work that they're doing. So, Governor, thanks for your leadership. Because leadership matters. Everyday leadership matters, and you've been spot on with your team through the last 15 months, and now as we sign the fourth pillar, this is going to have a huge impact for all of us in the state of Illinois. The Honorable J.B. Pritzker, Governor of the state of Illinois.
Well, thank you very much, Edgar. It's so great to see everybody today. It's a beautiful day outside, and it should be, because it's a great day here at Memorial. I want to say a special thank you to your team, Edgar, because this, frankly, the work that gets done here at Memorial has been life-saving, and it has been something that's made a real difference in people's lives. Those who have touched Memorial, never forget it. They've been changed for the better. And I am truly grateful to have Memorial as a partner in the work of making quality, affordable health care more accessible to all Illinois residents. And that's a mission that we're here today to advance. Last summer, tens of thousands of Illinoisans took to the streets of Chicago and Springfield and Anna and East St. Louis and Decatur, Champaign, and cities and towns all across our state. And people cried out for justice, for the end of systemic racism, for police accountability, for criminal justice reform, and for an end to the disparities in healthcare and job opportunities and education that plague too many of our institutions. And even in the middle of a viral pandemic that disproportionately impacted Black and brown communities across our state, the Illinois Legislative Black Caucus found a way to pursue meaningful change, gathering allies in the General Assembly and securing passage of 4 transformative pillars of their legislative agenda and sending those to my desk and making Illinois a national leader in tackling structural racism head on. It has been my honor to stand with the ILBC as an advocate and as an ally on each of the other 3 pillars: criminal justice, education and workforce development, economic access, equity, and opportunity. And today, it's my privilege to sign the fourth pillar, the Illinois Healthcare and Human Services Reform Act, into law. This legislation advances a key belief of mine that I know is shared by everyone standing here and millions of residents across Illinois. Healthcare is a right, not a privilege. But for too long, too many Illinoisans have been denied that right, whether through healthcare deserts, inexcusable delays in Medicaid applications, through lack of access, through high premiums, through doctors untrained to recognize symptoms on Black skin. The Illinois Healthcare and Health Services Reform Act takes sweeping action to address those inequities and obstacles, establishing new requirements for implicit medical bias training for all licensed medical professionals, capping costs for blood sugar testing equipment, building out a community health worker certification and training program, increasing oversight and transparency around Medicaid managed care systems for its customers, and launching the Anti-Racism Commission to identify and propose statewide policies to eliminate systemic racism. And it extends legal protections for people seeking help for an opioid overdose, because persecuting addiction gets us absolutely nowhere. Already, my administration's made great strides toward healthcare equity, authorizing telehealth coverage to increase healthcare access to vulnerable populations, including mental health services, eliminated the Medicaid backlog in our state, signed legislation to bring $250 million in new federal healthcare funding to Illinois, turned the Healthcare and Hospital Transformation Bill into law, and worked with the General Assembly to make Illinois the first state in the nation to offer healthcare access assistance to undocumented seniors. There are so many people who helped Illinois get to this moment, some of whom we're fortunate to have with us today. And I'll start with our champions in the General Assembly. Let me begin with Leader Maddie Hunter and Representative Camille Lilly, who demonstrated a steadfast commitment to tackling the issue of healthcare disparities caused by generations of racism and disinvestment. Leader Kimberly Lightford, Speaker Chris Welch, and Senate President Don Harmon. I want to thank all of them. Their leadership really helped to get all of these pillars pushed forward, and without whom we would not have seen any of these bills. But so much of what we've hoped to accomplish in state government would not be possible without the three of them. Leader Greg Harris and Senator Ann Gillespie, for their leadership. I want to recognize them for their leadership in the Medicaid Working Group. Representative Mary Flowers, for championing maternal health, and someone who has done this for decades, truly for decades, and who is now seeing the fruit of the work that she brought to the General Assembly. Senator John Curran, who saw that accessible, affordable health care for all transcends party lines. And of course, the entire Illinois Legislative Black Caucus, including Leader Jackie Collins, Senator Robert Peters, and Senator Doris Turner. Thank you all for the work that you've done. Let me also recognize Lieutenant Governor Juliana Stratton, whose unwavering commitment to address root causes of violence, root causes of the lack of health care in our communities is reflected in this pillar. And Illinois Department of Healthcare and Family Services Director Teresa Eagleson for the late night conversations, analysis, and support that her team gave to help make this legislation move forward and get across the finish line. I'm also proud to stand with many advocates who have joined us this morning. Letitia Boughton Price, President and CEO of the Illinois Community Health Workers Association. Dr. Ruby Mendenhall, Assistant Dean for Diversity and Democratization of Health Innovation at the Illinois College of Medicine. Dr. Kari Wolff, Chair of Psychiatry at SIU School of Medicine. Pastor Tony Williams of King International Ministries. And Jordan Powell and the Illinois Health and Hospital Association. And then there are those many people that are outside of this room who made this day possible. Voices for Illinois Children, Start Early, and Ever Thrive Illinois, and others. Let's also recognize that many activists and advocates who have dedicated truly years, perhaps decades, lifetimes, to calling for justice are the shoulders that we stand upon today. Let's be clear. Justice isn't just about what happens in a courtroom. Justice is access to economic opportunity, to a great education, and yes, to affordable, quality, personalized health care. It's about recognizing that communities across our state have been left out and left behind, and then doing something about that. Thanks to the Black Caucus, the 4 pillars are now law. Illinois is a few steps closer, some giant steps closer, to the justice that our residents deserve. So with that, I'm very proud to turn it over to a true leader in state government, infusing justice and equity and opportunity into everything that we do across our state government, and that's Lieutenant Governor Juliana Stratton. Juliana?
Good morning, everyone. Thank you, Governor Pritzker, for that kind introduction. As you continue to lead us through this pandemic, today's bill signing is just one more example of your commitment to equitable access to health care and building healthy communities across our state. The governor has already acknowledged our esteemed speakers and those joining us today. So in the interest of time, I'll just say to President Harmon, Speaker Welch, and all of our special guests, it's good to see you and even greater to work alongside you on behalf of the people of Illinois. Of course, I also want to acknowledge the chief sponsors of House Bill 158, Leader Maddie Hunter and Representative Camille Lilly. You both did a remarkable job, and because of you, more people will have access to the health care that they need and deserve. And to President Curtis and your entire team at Memorial Health System, thank you for being such gracious hosts. To you and to all of the essential healthcare workers all across the state, you are and continue to be our heroes, and we thank you for your dedicated service. April is National Minority Health Month. And it's not surprising that this year's theme is Vaccine Ready, with a particular emphasis on how Black, Brown, and Indigenous communities have been disproportionately impacted by this pandemic. From the very beginning, the disparities were evident. And just a few weeks ago, the Centers for Disease Control confirmed what we already knew about these disparities relating to communities of color. Our communities are more likely to contract COVID-19. We are more likely to go to the emergency room due to COVID-19. We are more likely to be hospitalized with COVID-19. And yes, we are more likely to die from COVID-19. This is exactly why Illinois' vaccine rollout has been done with equity as a driving factor, with community-centric and walk-in vaccination sites, partnering with FQHCs, and using patient navigators for outreach and support. Because these disparities are not new, and they were not surprising to those of us who have experienced generational inequities in healthcare delivery and access. The disparities are rooted in the structural racism that is at the foundation of a healthcare system that was built upon the notion that people who look like me are biologically defective, less susceptible to pain, and undeserving of equal access to the very best healthcare, including mental health care. This is why I appreciate the Legislative Black Caucus 4 pillars, because with each pillar, they went below the surface to tackle the root causes, which is a key precursor to systemic change. House Bill 158, being signed today, is not only about expanding access to health care, though it is that. It is not only about ensuring better quality health care, though it addresses that too. But this pillar seeks to eliminate inequities in our state's healthcare system. It makes it clear that when we say that healthcare is a right, not a privilege, It means that your race or your zip code should never be the determining factor for how healthy you are or how long you will be expected to live. So whether it's trauma-informed training for daycares or pathways to address maternal and infant mortality, or funding that will go to safety net hospitals for perinatal care, along with so many other provisions, this pillar will give our babies and children a fighting chance from day one to have healthier outcomes than those who came before them. And when children and families are healthy, our communities are healthy, and healthy communities lead to a healthy state. Governor, thank you again for today's bill signing, and thank you again to the Illinois Legislative Black Caucus for your leadership. We stand with you and will work with you to implement the provisions of this pillar. It is now my honor to introduce a person of vision who is hands-on and connected with the communities she represents, and she also happens to be my state senator, Leader Maddie Hunter.
Thank you, Lieutenant Governor. Good morning, everyone. I am pleased to be here for the signing of the Health and Human Services pillar, the final piece of the Legislative Black Caucus plan to eradicate racism. I'm very excited to be here, standing next to the governor and all of my colleagues and friends. We have worked extremely hard on this legislation, actually for almost a year. After George Floyd was senselessly murdered for all to see, there was a reaction against racism that we have never seen before. There seemed to be an unprecedented support for the plight of African Americans, felt from Minneapolis all the way to London. I don't have to remind you all that racial unrest was the only crisis felt globally. The COVID-19 pandemic has taken a toll on every race and every region of the planet. While it has wreaked havoc on every demographic, people of color have been more susceptible to be infected with COVID-19, with hospital rates of Black, Latinx, and Native people 4 times higher than those of white people. Institutional racism has caused communities of color suffering from a plethora of health disparities even before the pandemic came and took the world by storm. Although we have been fighting to eradicate racism for decades, last year my colleagues and I saw a unique opportunity to make the most radical structural changes in Illinois that they've ever seen. In the midst of the racial unrest and heightened changes to the healthcare industry, instigated by global pandemic, it was not a matter of what needed to be done to combat these issues, or even a question of when. We knew drastic measures needed to be taken as soon as possible. We needed to figure out the logistics and how. So we had a series of hearings, listening to testimonies from top experts in the criminal justice, education, economic, and human services industry. All that to say, the legislation before you is deeply informed and methodology crafted. We have spent many months and sleepless nights just on the healthcare pillar alone. And today I am only ecstatic that this work mounted to something, but even more so, thinking of all the lives this legislation will impact for the better. Numerous studies have shown racism is the root of various health inequities experienced by African Americans to this day. African Americans suffer at higher rates of chronic diseases, including diabetes, hypertension, heart disease, asthma, and many cancers. We experience more negative health outcomes as a result of implicit bias among medical professionals. A Black person's life expectancy on average is less when compared to a white person's life expectancy in Chicago's Austin West Side neighborhoods to the Chicago Loop, that there is a difference of 11 years between Black expectancy, 71 years of age, and white life expectancy, 82 years. There's a prevalence of health deserts in Chicago communities and Black communities. The healthcare providers that are located within these neighborhoods tend to offer low quality care. Worse than that, essential safety net hospitals such as Mercy Hospital in my district were facing closure in the midst of a global pandemic. Altogether, the above mentioned only begins to capture a portion of the larger system of racial inequities and injustices. Therefore, this legislation, as informed by the Joint Black Caucus and the Health and Human Services Pillar subject matter hearing, seeks to remedy a fraction of this broken system by addressing the following areas in this package: access to health care, hospital closures, managed care, organizational reform, healthcare workers certification, maternal and infant mortality, mental and substance abuse treatment, hospital reform, and medical implicit bias. The measures in this package, such as putting a halt on hospital closures for up to 60 days, establishing a Medicaid MCO commission to evaluate Illinois managed care programs, and requiring the state to facilitate partners between federally qualified health centers and hospitals, and creating Health and Human Services Task Force and an anti-racism commission will help to reshape our state's health care, leading with diversity, inclusion, and justice at the center. Addressing these areas will dramatically alter the structure of our healthcare system for the better. For Black lives to truly matter, their right to quality healthcare must be inhibited, or it is our responsibilities as elected officials to create laws that create an enriched, lasting impact of the communities we represent. This legislation does just that, and there is no better time to enact it. I'd like to thank everyone who has worked on this measure with me and all those who supported it, especially the governor, my leader, Senate President Don Harmon, and Speaker Welch, the SIU School of Medicine in here, University of Illinois in Carbondale, community-based providers, and last but not least, we in the General Assembly cannot do anything. We cannot move without our staff. And we have the best staff that we've ever had. Patricia Rodriguez, the lady over here in the front row in the red dress, she's the lead person in the healthcare committee. And her counterpart, who was not here, he's still working, Danny Mendez, he's in the house. Without these folks, you guys, we wouldn't be here today. So I'd like to thank everyone for making today possible. And at this time, I'd like to introduce the sponsor of the House, my colleague and my good friend, Representative Camille Lilly. Thank you.
Thank you, Leader Hunter. Good morning. I'm going to start with, if you don't have your health, you don't have much else. I also want to start with thank you to so many people who worked tirelessly to get this done. Of course, the co-chair of the fourth and final pillar of the Illinois Legislative Black Caucus policy agenda, Leader Hunter. She mentioned our partners in the Senate. Thank you, Patricia, for all of your understanding and all of your insight to this bill. Thank you. I want to thank Danny Mendez. We came to this task pretty much as freshmen. We've never done an omnibus bill before. I want to thank Ruth Adikel, intern from University of Illinois, who compiled over 100 pieces of legislation. Thank you. I want to thank President Harmon, who started this task with all of us in the Black Caucus, who said, whatever you need, I'm there. Thank you. Yes, this pillar started with Speaker Madigan, but ended up with a young man who said, let's take it to the end zone. Thank you, Speaker Welch. Awesome. Now, you're going to hear a lot of the same components of this bill because health care is important. And it also means we have been heard. We had over 6 to 8 subject matter hearings where the people of Illinois spoke about their needs in health care, their needs in human services. They shared their stories and their concerns for a challenged health care access here in Illinois. We had dozens of meetings with staff that made us understand why this was an important pillar. It may be the final one, but I believe it's one of the most important. Because if you don't have your health, you don't have much else. Yes, the Illinois Legislative Black Caucus Health and Family Service pillar was created to address the continuous health inequities experienced in the Black community, in the brown community, in the poor communities here in Illinois. We need to take action to implement key reforms to the health and human service systems that has only allowed a racial disparities in our communities, that many families have been challenged and frankly have not survived. HB 158, remember that, because it's the first step, and as we as a collective will address the health issues in Illinois, it's only the first step. It provides initiatives that brings access, equitable access to comprehensive care for diseases such as dementia and sickle cell. It specifically provides medical anti-bias training for all clinical professionals and educates our professionals to understand that we have a diverse community, a diverse nation that requires attention in their culture and where they are meeting them. Increase usage of safety net programs and safety net hospital to address moms, African-American moms, Latino moms, our seniors, because our moms and children are not surviving their delivery and they're not living to their first birthday. We must continue to protect and provide much needed rehab services for those who find themselves addicted to drugs and living a substandard life here in our state. We must stop people from dying from overdoses. It is so important that we continue to undertake this systematic view of ridding racism in the areas of healthcare and human services. Our goal is to improve health outcomes across the state of Illinois. Our goal is to improve the policies by including a racial impact note that allow us to understand the legislation that we're putting in front of the people of Illinois, that is not causing discrimination and challenges for access to health care and just basic needs in life. Food, housing, transportation, jobs, healthcare. Our policies have created challenges for the citizens of Illinois, poor Black and brown citizens in neighborhoods. We want to continue to make sure that we are stopping the violence in our community because violence is a disease, is a public health crisis that is extending beyond one community, but across the entire state. HB 58 is a significant first step towards improving the quality of life for millions of Illinoisans. Not just one group, millions of Illinoisans. Yes, the statistics in the Black community are sobering. We suffer from higher rates of chronic diseases and diabetes and hypertension and heart disease and asthma and many cancers. Yes, the Black community has twice likely to die from opioid overdose, but white people are dying too. Black people life expectancy should not be determined by their zip code. They should just be able to live where they are feeling comfortable and supporting their families. Black women, again, are 6 times likely to not survive the pregnancy of their newborn. And violence is an existing issue daily in Black, brown, and poor communities. These statistics are not merely consequences. Study after study, report after report has shown that these populations, these neighborhoods, generations has been acknowledged today as racist actions. Racism, it exists. But we have to work together with the relationships and the understanding that we all deserve quality of life. And we must work together. I want to thank the man who just said, hey, this is going to get done, Governor Pritzker. Thank you. When you have a team or governor who understands we have to do this together and signs not only one bill, not only 2 bills, not only 3 bills, but signs 4 pillars, that's going to be the essence of Illinois. I thank you. And I know he's been listening to his running mate, teammate, the whole way. Thank you, Lieutenant Stratton, for understanding we must be in each other's ear to get this done and lift each other up by the elbows to say, we're going together. Yes, healthcare is a human right. Yes, the basic needs are important. Access gets us there. Thank you, Senator. Thank you, Senator Gillespie, for always understanding what I'm talking about when I'm talking. Thank you. As I mentioned, this is a good day for all of us, and I want to thank you for allowing me to say the words that are coming from my heart. But I want everyone in listening ear and seeing eye to know that the state of Illinois cares, and we're here to do it together. And so with that, I'd like to bring our newest leader in the House, Speaker Welch, who's going to take it again into the end zone. Thank you.
Good morning, everyone. I want to begin by thanking Governor Pritzker for having us here today for this truly historic moment in our state. I want to thank Representative Camille Lilly, Senator Matty Hunter, and the entire Illinois Legislative Black Caucus for working with a number of community organizations to get us here today, to get House Bill 158 passed, signed, sealed, and delivered for the people of the great state of Illinois. Of course, we are here to celebrate the signing of a law that will chart the path forward for a more equitable health system for Illinois residents. We are doing this as we still continue to face a global pandemic that is not yet behind us. We've seen great progress here, and it's because of our governor and his great leadership. Nearly 60% of Illinoisans over 18 have received at least one dose, and 36% are fully vaccinated. Please continue to get vaccinated. It's safe, it's the right thing to do, and it's going to get us back to normal sooner than later. The road has not been easy getting here, but we're here and we're getting better. It's no secret, unfortunately, that the brunt of the pandemic was felt by communities of color who have long faced medical and health disparities. Going back to normal, going back to what we knew before the pandemic, won't work. Normal didn't work for us. It didn't work for our communities. We can't go back there. Black, brown, and Asian women face disparities and prejudice when bearing a child. Our kids don't get enduring preventive care or culturally relevant mental health services. Our seniors don't get equal care for chronic conditions. We have to do better. We can do better, and we will do better, starting today. Thankfully, the health equity pillar of the Black Caucus is now law after the governor puts his signature on the 4th out of 4 bills. Governor, you're batting 4 for 4, and the Cubs could use you in the lineup right now, because that's a heck of a batting average. This bill will create an anti-racism commission to eliminate the systemic racism so prevalent in our healthcare system. It would halt the closure of hospitals across the state, mostly in poor and low-income communities like the one we represent. And it will require implicit bias training for all medical professionals. These are just some of the things that this comprehensive bill does to make a more inclusive and equitable health system. Now we need to empower our healthcare and medical professionals to institutionalize these changes. Let's let them do their job. Let's let them get to work. I am confident we can make this a reality if all parties continue to collaborate and be partners in this great endeavor. Let's continue to all work together for the betterment of Illinois. Please welcome to the podium my good friend, hardest worker I know, Senate President Don Harmon.
Thank you, Mr. Speaker. It's a pleasure to work with you. I want to congratulate the Legislative Black Caucus on this accomplishment, especially my state representative, Camille Lilly, our great Senate sponsor, Leader Maddie Hunter, as well as Senator Doris Turner, Senator Jackie Collins, who was such a strong hand in the equity pillar, and Senator Robert Peters, lead architect of the criminal justice pillar. I know I wouldn't be at this event if it wasn't for the Black Caucus and specifically Maddie Hunter. I mean that literally. She told me I had to speak. But I stand here today as a proud ally of the Legislative Black Caucus because in the end, that's all that the caucus needed, allies to stand with you and to support your work. So I'm here in demonstration of that alliance. I'm so happy to see Senator Ann Gillespie, one of our caucus's healthcare experts and a staunch ally herself, as well as our staff. Tricia, it was great to get you that shout out. You did a ton of work and we're very grateful. It's been an honor to be part of the work you have done, and I look forward to our continued achievements. So congratulations to the members, and thank you, Governor Pritzker, for your support. It's now my pleasure to introduce our home senator representing this district, Senator Doris Turner.
Good morning. I would like to thank everyone who's joining us today, whether in person or through other media outlets. And I would especially like to thank Governor Pritzker for your continued support and commitment on the issues of fairness, justice, and equality included within the healthcare pillar as we as well as the other pillars that you have signed into law. And to my colleagues who have led the fight for equity and inclusivity on these important issues, thank you for your leadership and dedication to real progress. As a public health professional, I understand, maybe more than others, the importance of equity as it relates to public health and the healthcare systems. The pillar we have before us today addresses a range of issues within our healthcare and human services industries. I hold the belief that everyone, every single one of us, deserves access to quality, affordable health care. However, unfortunately, that has not always been the case historically for Black, brown, and low-income families. But today, and a historic day that it is, today, with the signing of this legislation, there is hope. This pillar, among other things, provides an expansion of women's reproductive health services, provides comprehensive preventive health services for chronic disease, and creates community-centered training to improve overall health outcomes in Black and brown communities. And the key words in that sentence are community-centered. That's what's most important, community-centered training. The COVID-19 pandemic exposed many vulnerabilities throughout our healthcare system, some of which a lot of us already knew existed. We have seen how the lack of access to proper health care continues to disproportionately affect communities of color. This legislation will begin to put an end to the legacy of racial discrimination in the healthcare system and will begin to overturn the low level of trust Black and brown patients have with medical providers in this state. As the stroke of the governor's pen signs these bills into law, it will also place an exclamation point at the end of the statement. Access to safe, reliable, affordable health care is a right. I now invite Leader Collins to the podium.
Good morning. First of all, I'm so proud to stand here with the leadership in the House and the Senate, and especially the governor, Lieutenant Governor Stratton, and of course, the healthcare pillar co-chairs, and I have to mention their name. I know time is tight, but I want to give recognition where recognition is due. I want to thank healthcare pillar co-chair, Senate Majority Caucus Chair, Maddie Hunter, and Representative Camille Lilly for their hard work. And I want to thank all who made this day possible, and to all of those who refuse to let the issue of Black maternal and infant mortality be ignored. We have seen studies that show a college-educated Black woman in a high-paying career, such as tennis star Serena Williams, is more likely to die as a consequence of childbirth than a white woman without a high school diploma. This is not just about class, and it is not just about gender or misogyny. This is about race, and we need to respond to it as if it is. Last session, I joined healthcare champion House Deputy Majority Leader Mary Flowers in pushing legislation to address the shocking rise of maternal and infant mortality. Our efforts included many measures and ideas incorporated in this pillar, and I'm glad to see that this healthcare pillar confronts the reality of what Dr. King once said: of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. In this nation in the 21st century, it is a shame that between 700 and 900 women die in the United States each year from pregnancy-related complications, most of them preventable. And in Illinois, African-American women are 6 times as likely to die from such complications than their white counterparts. Meanwhile, the racial disparity in infant mortality is now wider than it was in 1850, more than a decade before the abolition of slavery. A growing body of medical research points to trauma-induced stress including trauma caused by encounters with racism and systemic racial injustice. That's the lived experience of many in this country as a significant cause of higher maternal and infant mortality rates, near-death rates, and low infant birth weights among African Americans. But today, with the signing of this legislation, we are turning the page on healthcare disparity, abuse, and neglect. And with that, I have the honor of introducing my colleague, Senator Curran, to the podium.
Good morning. I'm John Curran, State Senator for the 41st District, representing DuPage, Will, and suburban Cook County. It's a pleasure to be here this morning with everyone for the signing of this legislation. I'm proud to have supported the Illinois Healthcare and Human Services Reform Act. It addresses issues of great importance: healthcare access, infant mortality and maternal mortality, mental health and substance abuse treatment, and hospital access in low-income and underserved communities. This legislation will go far in addressing racial and other imbalances within the Illinois healthcare system and takes important steps in expanding medical services in our lower-income communities. As a father of four, this issue is personal. I believe all children, regardless of background and demographic, deserve equal access to comprehensive healthcare services to maximize their chances of being safe and healthy. I want to thank the Senate sponsor, Maddie Hunter, and the House sponsor, Camille Lilly, for their dedication and their perseverance to ensure that this very important piece of legislation made it across the finish line. With that, thank you, and I want to introduce Teresa Eagleson, Director of Healthcare and Family Services.
Thank you, Senator. Good morning, everyone. I'm here today representing a dedicated team of professionals that run the largest health insurer in the state. As the director of the Department of Healthcare and Family Services, or HFS. As one who also lives in this community, I want to thank Memorial, SIU, and the top-notch staff across the system who serve everyone in the community with respect and dignity, regardless if they have Medicaid or another private insurance to cover their care. We at HFS are in full support of the aims of the Illinois Legislative Black Caucus Healthcare Pillar Bill to reduce disparities in the healthcare system and to reduce barriers to accessing quality care that exist for too many people across our state, particularly people of color, but also for people in rural communities and working families across our state. Thank you so much to Senator Hunter, Representative Lilly, and to the many others, including their staff, who played a role in advancing this legislation. At HFS, our mission every day is to help people access high-quality health care to advance their mental, physical, and financial well-being. This legislation takes a wide range of steps to address inequities that exist in the healthcare system. This legislation also dovetails with the healthcare transformation bill that the governor signed last month, where underserved communities are prioritized and health and social serving entities are encouraged to come together to collaborate so that every Illinoisan can receive the quality care they deserve. In addition to supporting the many worthy causes that have been mentioned here today, this legislation complements ongoing efforts by HFS and the Department of Public Health to address maternal health. The maternal morbidity and mortality rate in this state is alarmingly high for women of color, and we must continue to combat health inequities so that all Illinoisans can get the services they need and have better outcomes, regardless of the color of their skin or the zip code where they live. Illinois recently became the first state in the country to provide Medicaid coverage to women 12 months postpartum. It's a fantastic step forward, but we have more to do. As Governor Pritzker and all of us believe, healthcare is a right, not a privilege, and removing barriers to make sure all Illinoisans can reach the services they need is critical to achieving better outcomes for all people. It's my pleasure to introduce Letitia Price Bounton as the next speaker.
And I'm going to call my partner, Wandy Hernandez-Gordon. So we too want to recognize the leaders, the staff, and Governor Pritzker for working to pass this historic legislation. We are here today representing 400 plus members of the Illinois Community Health Worker Association, most of whom are African American and Latino. We thank you for honoring our motto, nothing for us without us, and including ILCHWA in the decision-making process which affects community health workers in Illinois. This past year and a half has illuminated the inequities felt by our Black, brown, and rural communities for decades. This pillar legislation says yes to a new day and further aligns with the essence of community health workers, which is the genuine care, support, and advocacy for the communities we come from and we serve. We are grateful and look forward to our continued involvement and implementation of this pillar bill. And I want to give my colleague a couple. You want to say something? Or no?
Gracias a los líderes, a personal y gobernador Pritzker por esta historia de la propuesta HB 158. Estamos agradecidos y estamos esperando que este bill vaya a ser algo beneficioso para nuestra comunidad latina. Así que muchas gracias y aquí estamos. Y Leticia y yo representamos la Asociación de Promotoras de Salud de Illinois. Muchas gracias.
And with that said, we would like to invite Dr. Ruby Mendenhall to the microphone.
Hello, everyone. Hi. I am an associate professor in sociology and African American studies at the University of Illinois, Urbana-Champaign, and then also assistant dean at the Carroll Illinois College of Medicine. And I want to thank you for inviting me here today to celebrate this historic legislation by the Illinois Legislative Black Caucus, which represents the fourth and final pillar of their agenda to address systemic racism and to create structural change. During a global pandemic, police killings, social unrest, and community violence, it is good to see the visionary leadership of Senator Hunter and then also Representative Lilly, who guided HB 158, the entire Legislative Black Caucus and their staff, Tricia Rodriguez and Danny Mendez. The historical context that I just mentioned is why House Bill 158 is so important. We need a core of community health workers in every community across the state to foster health, well-being, and a sense of community, and yes, even hope. House Bill 158 also addresses workforce development, especially in communities of color. Community health worker initiatives can serve as pathway programs to nursing, behavioral health, and medical careers. With the help of Morehouse School of Medicine, we are training high school students to become community health workers and to learn about childhood trauma. They will have access to our new wellness store. The students are also part of our College of Medicine's pathway program. And I will conclude by saying that we are in intense times that call for bold policies to address racism. House Bill 158 is such a policy. So thank you to the governor, to the lieutenant governor, and everyone in this room. And at this time, it is my honor to introduce Dr. Kari Wolff, who is the chair of psychiatry at SIU School of Medicine.
Good morning. I'd like to thank Governor Pritzker for inviting me to this monumental event, and I'd like to thank Senator Hunter and Representative Lilly and the entire Black Caucus for allowing me to contribute to this important legislation and help identify solutions to the cracks in our healthcare system, cracks that are wider for people of color given the systemic racism that affects healthcare and other agencies that impact health. I'm really excited today because this legislation creates funding for programs that have proven effective in other states. It creates training that will prevent the development of mental illness and other diseases, and it helps SIU and other universities in Illinois to build a workforce that reflects and is responsive to the people we serve. We at SIU stand ready to use this legislation to improve the health of all people living in Illinois. And now I have the honor of introducing Pastor Tony Williams from King International Ministries.
Good day, everyone. Tony's a nice name, but my name's Anthony. I'm Anthony. I'm very humbled to be here today, Mr. Governor, and to this august body, to our Speaker of the House, President, Lieutenant Governor, and all of you. Camille, Lilly, Lisa Hernandez, and LaShawn Ford started a journey with me. We did hearings around the state on violence as a disease. We discovered that violence is the #1 problem of the 21st century. On February 21st, 2018, my son Nehemiah Williams was violently killed. His life was lost. And I knew that I had to respond. My family expected me to respond intelligently. And so I went to these distinguished lawmakers and said, we've got to pass legislation. The CDC, and I'm not the CDC, says violence is a disease. Violence is a public health crisis. Violence is a pandemic. Mr. Governor, we're facing 2 pandemics, COVID-19 and violence as a disease. On May 19th, we met at First Congregational Church with the United Church of Christ, which I'm a part of. And this wonderful process, which is a part of the historical bill, began to take place. Well, Malcolm X was killed on February 21st, 1965. May 19th was his birthday, and the next day was the day of Pentecost, and I said something revolutionary was about to take place. Yesterday in Washington, D.C., I bragged on you. I said this state will be the first state to ever declare violence as a public health crisis because none of us are safe. Mr. Governor, it don't feel good when somebody kills your son, when somebody kills your legacy, when somebody kills, it don't feel good to be dealing with current traumatic stress, not post-traumatic stress. It's current traumatic stress. It is not systematic racism. I don't even talk about racism. It is systemic violence, structural violence. We are now a new America. We are now in changes like never before. There's a paradigm shift in the universe. And if we are going to survive, we must deal with this leviathan of violence like never before. 1-year-olds getting shot, people getting, come on, who lives like this? Accepting an abnormal behavior as a normal behavior. Are you safe where you live? Whether it's Inglewood, whether it's Winnetka, even on your block, Governor, I've been by your house. It ain't safe nowhere. Let us be known, not only as the land of Lincoln, but let us be known as the land of civility. We need civility right now. None of us are safe. So this is historical. And Governor JB, you're my friend, you're a father like I'm a father. I need you to call President Biden today. He'll pick up the phone for you. He's got a major speech tomorrow, and it's not about guns. That's a symptom of violence. There's 18 levels of domestic violence, 4 levels of global violence. Houston, we have a problem, but we will win this problem. Tell the president to call violence a public mental health crisis. I conclude by saying this to you all. Let your light shine in these pandemic times. All of you all, press, media, let your light shine. Whatever you're going through, let your light shine. Because we have to move this state forward and this nation forward. And Governor J.B. Pritzker, I want to thank you for your leadership. Speakers, all of you, because now you all are making history. The first state in the union to declare violence as a public health crisis. Now we can get at this problem the right way with solutions. God bless you all and thank you. I want to bring our distinguished governor up for the signing of this historical legislation. Now all you all can say amen.
Amen. You know how to bring it up. Last but not least. Okay. Happy to take questions from members of the media.
When you ran for office, you pledged to veto a map drawn by legislators in a partisan way. Do you plan to keep your word?
Well, as I've said, I will veto an unfair map. I've also said that in order for us to have an independent commission, we needed to have a constitutional amendment, something that would actually change the way the process operates today in the Constitution. That did not happen. So now, as we reach the end of this session and I look to the legislature for their proposal for a redistricting map, I'll be looking to it for its fairness. And that's something that's vitally important for our state, has an effect on the next 10 years and representation throughout the state.
Just to follow up real quickly, you did address that in your comments in 2018 and said even absent a constitutional amendment, the Republicans and Democrats could just get together and adopt the map that an independent commission drew.
Well, I do believe that Democrats and Republicans should get together to adopt this map. I hope that Republicans will choose to work with Democrats on the map. Right now, it looks like they're just saying no. They're not really engaging, and all they're doing is fighting in these redistricting hearings, which I think have been so important for hearing what people across the state really want in a redistricting map.
To the bill or the law that you signed, how much is it going to cost, and how do we pay for it?
You're talking about this law here? Actually, this law has a very reasonable law. It's something the provisions of which I approve of, something that I believe in, and something that I've been fighting for in a variety of ways before we ever were able to put this law together. So, in terms of what the cost of further advancements in healthcare are going to take, I'm very much in favor of making sure that we're reaching particularly the communities of color and people who've been left out and left behind. That includes rural communities that often don't get the health care that they deserve either. So I'll continue to work very hard to make sure that we're providing that health care and to find the resources necessary.
Did it say it could cost upwards of $15 billion? I mean, is that number?
No, that's inaccurate. And of course, they're exaggerating, as they always do about this. And, you know, we're going to work very hard to try to implement the provisions of this law. It will take us some time and effort. I'll be working together with the legislators to make sure that that happens. Dave, sorry, he was next, and I'll get you.
How's a fair map different than the map we have now?
Well, actually, I would say that the map that was put together for the last 10 years started out with a very strong leaning toward fairness, which was the Supreme Court rulings of the past dictated the drawing of minority districts in the state to start with that map, and then you have to draw from there. As you know, Dave, there are parts of the state that are overwhelmingly one party or another party, and it's very difficult to draw competitive districts in those areas. But I do believe that once you put these Supreme Court rulings onto the map face, then you can begin to put this, fair map and something that is inclusive of all of our diversity across the state into that map.
Yes, but if I'm not mistaken, Chinatown is in 4 districts. The one congressional district looks like a claw with hardly any contiguity. I mean, it seems to me that those are ripe for others to, if not say are unfair, at least make fun of. I mean,
well, I think that, look, the legislature is working on the map for the next 10 years. They've been holding, I don't know how many hearings now, it feels like dozens. I've listened in on quite a number of those. I think that people who want representation want to make sure that their community is wholly represented within one district, or they want to make sure that their town or their city is wholly represented within one district, I think have made their views known, and I think that the legislators have been listening to them.
Are you okay with using population estimates, or should they wait until the official census numbers come out?
Look, I don't think the legislature has yet said what estimates or what numbers they're going to take from. It could be one or more data sets that they might use. One thing I will just offer up is that we should pay close attention to the fact that the census data that came out yesterday, just setting apart from redistricting just for a moment, the census data that came out yesterday, I think, exceeded everyone's expectations. There are many, carnival barkers and people who have run down this state for years who have said, talked about that we've lost hundreds of thousands of people over the last 10 years. As it turns out, it's about 7,500 people. And I think that's because a full count was done in that census data, and that's a very good thing. And because of policies that I believe that we're pursuing in our state to not only keep our students in the state, to make college more affordable to them, but also the high quality of healthcare that we're providing and working on providing, and the fact that we have worked very hard to create the opportunity for job creation through new businesses that are created in Illinois. Oddly, I think many of you would find this surprising, in 2020, 169,000 new businesses were created in the state of Illinois. That's planting a lot of seeds for the future.
Where do you stand on a film tax credit, and how do you square that up with your push to close other so-called tax loopholes?
Well, there are an awful lot of tax credits that are offered in this state. You can go look at the list yourself. And as you know, there are some that are from days of old for providing benefits to industries that may not need them any longer, or to the wealthiest businesses in the state who, in a pandemic, we need them to step up to the plate. Folks who made money during the pandemic did very well during the pandemic. In fact, we want them to be able to step up and help us pay the bills for the pandemic. So you can't just say that every tax credit ought to be, is something that we've thrown on the table, or that we haven't picked and chosen what the right ones were. But the film and TV tax credit, as you know, is something that has helped us attract a new industry to the state of Illinois. In fact, it's expanding even now as a result of that tax credit. That's just one example. The data center tax credit, these were things that I advocated for, either the extension of or the creation of. The data center tax credit is another one where we've brought literally over $1 billion of investment into the state of Illinois as a result of the data center tax credit. By the way, that was something that I worked with Republicans to put in place. It is something that is very effective, and I want to keep that in place.
Will Illinois follow the CDC?
Can I get one? Somebody who hasn't asked a question. I think Mike. Yeah.
This one is for Leader Hunter. I remember on the floor during the debate for this bill, you're specifically saying that you've been fighting for this for years, and Illinois is truly trailblazing here. And other states have asked to hear how you're able to do this. How does it make you feel today now that it's at the end and it's up?
Thank you for that question. I'm really ecstatic about it. I'm really, really emotional right today. I've been a legislator for 18 plus years, and I've been passing separate pieces of legislation over the years dealing with diabetes. My mom had diabetes, and she wound up having kidney failure and eventually dying. My father died of heart disease, and just a lot of loss in my family and within my life. And so today